Welcome to the Sacramento County podcast series. I'm your host, Kim Nava. Today, I'm here with Emily Halcon, the county's Director of Homeless Services and Housing. Emily, thanks so much for coming in today to speak about your department.
Thanks for having me.
So first of all, tell us a little bit about why the department was created. Why did the county feel like it needed this department?
Yeah, as you know, we're the newest department here in the county, and we're really proud to be taking on this role for the county. The county's worked in homeless services through other social service departments for years, and many of them continue to play really, really important roles. But as the crisis of homelessness has risen, as the community's interest in new and varied solutions has risen, and the board's, I think, commitment to make some demonstrable differences, I think making the department really signifies that commitment. When I think about the department, I've told many people this, I think we're unique in a lot of ways. And one of the ways is that this department, unlike most other social services, is definitely a moral responsibility of us. But there's no regulatory requirement from the federal government or the state government for anybody to shelter or house people. We all are morally responsible. And I think that the board and the community really expects that of us. And so this creates a single place for the community to look for accurate and ongoing information, for transparent access, and really to make some demonstrable changes with what our ultimate goal is.
Absolutely, absolutely. So, Emily, what does homelessness look like in Sacramento County, and how you've been doing this for a while? How has it changed in the last, let's just say, 5 or 6 years?
Sure. Yeah. I think homelessness looks different no matter who you're looking at. I think a lot of us think about homelessness as we're walking down the street and we see somebody sitting in a street corner on a park bench or a big encampment under the freeway, and that certainly is a big proportion of our homeless population. But just as important is that some are hidden homeless. Families often living in vehicles, children or emancipated foster youth, some of our more elderly populations. And so I like to say that if we have 10,000 people experiencing homelessness in Sacramento County, which is our most recent estimate, that's 10,000 different unique stories of how they became homeless and 10,000 unique stories of how they're going to exit homelessness. But some of the commonalities that we see in the data, which we get primarily from a biennial point-in-time count. And we are about to get a new point-in-time count in probably the next month or so.
That's right.
But the last point-in-time count did show us some commonalities and some that are very, very concerning. Most notably, the aging of the homeless population, the length of time people are staying homeless. It used to be, 5 or 6 years ago that it would be unusual to see somebody who had been continuously homeless for more than a year or two. Now we regularly see people who report being homeless for 5, 6, 10 years. And of course that exacerbates underlying chronic health conditions and other challenges people have. And then, I'd be remiss if I didn't also point out that, like with other societal challenges, we see a lot of discrepancies in terms of overrepresentation of people of color. And it's something that bleeds through all of our social systems, and when you get to the homeless population, it's even more exacerbated.
Sure. So now let's do some myth busting, since we're talking about that. There are a lot of myths and stereotypes surrounding people that are homeless, why they're homeless, and why people accept or would refuse services. So I think one of the myths are that people are homeless on purpose. Do you see a lot of people who want to be homeless?
Yeah. Like you said, I've been doing this for a long time, and I have never once met somebody who's like, yeah, I want to be homeless. This is great. Certainly, you may encounter people from time to time who want to live off the grid or be one with nature. Those aren't the populations that we're focused on, and they are few and far between. I think that, what leads people to that belief is that they see folks experiencing homelessness who, for whatever reason, aren't able to or don't want to avail themselves of the services that they're offered. And so they then assume that means that you're choosing homelessness. And I think it's really important that we think about that in the context of our own lives. Right? If I were to tell you, Kim, if you want to keep your house, you can't possibly have that glass of wine tonight at dinner, or you have to give up your dog, or all these other things, you would laugh because That's preposterous that I would take choice away from you. And that's what some of our programs historically have done to folks experiencing homelessness. And I think the public who looks at that, I think they're coming from good intentions. They see people suffering, and they want people to have better opportunities. But when they see people making these choices, which they don't agree with, instead of trying to investigate why those choices are being made, they often turn to anger or frustration, and it's a shaming effect. And I don't think it's intentional. I think people want things to be better for people suffering on the streets, but we have to recognize that these people, just like you and I, should be afforded choices that align with their needs.
Absolutely. That's a really important perspective. Thanks for that. So let's continue with the myth busting, of course. The second myth is that homeless people are all on drugs or have severe mental health challenges. Even for those who do have substance use or mental health challenges, is there a which came first? Is this a chicken and the egg situation? Talk a little bit about that.
Sure. I think this is another place where it's very individual. Certainly there are folks who have suffered from behavioral health issues, who have drug addiction issues, and that push them over the edge into homelessness. There's also people who, because of their homeless experience, have turned to some of those issues, turned to some of those remedies, taking drugs or not engaging in treatment for their mental health issues. I think that what we do know, though, is that people's ability to engage in treatment services for those really significant issues is greatly enhanced when they're not wondering where they're going to sleep or where they're going to eat or where they can store their possessions or where they're going to use the restroom. And so we know that those are underlying issues and they need to be addressed, but I would hesitate to try to place blame on those issues as leading to somebody's homelessness. They're critical, and they certainly exacerbate people's experience while they're homelessness, but it'd be a very blanket statement to say that everybody experiencing homelessness is also suffering from those challenges.
Sure, absolutely. All right, another myth. Mm-hmm. Homeless people are so dirty. Why can't they keep their camps clean? What are some of the challenges homeless people face with basic care that we probably take for granted?
Yeah, I was thinking about this, just today. I mean, we're all humans. We produce waste. All of us produce waste, and we all have to manage that on our own. But you and I have access to showers and restrooms and a trash delivery service that comes and picks up our items from our house. Also, if we need to take something to the dump, I can lock my house and nobody's gonna come steal my items. And so I think that, living outside in and of itself is dirty, and it's not as healthy as all of us would want. But I think, again, this falls into a place where folks are living in the conditions that are available to them and making do. Now, certainly, we work very closely with folks outside to try to reduce that impact in the broader community. I would never want to not recognize that that's a real impact on the house community, on the business community, right? It's a real impact, but we also have to think about what conditions people have available to them so that they can afford to not create waste, right?
Sure. Absolutely. All right, and then rounding out the myths here, the final and probably something I know that I've heard, why don't homeless people just get a job to support themselves? What are some of the very basic or even much more complicated barriers people face to employment or renting apartment that can take them out of homelessness?
Yeah, no, I love that question. I think the first myth I like to bust is there's a lot of folks experiencing homelessness who are employed. Wages and the cost of living here in Sacramento often are mismatched, and so you'd be surprised to know how many people are experiencing homelessness who do have a job. Now, that being said, I also sort of think about my own life or think about your life. This morning, you woke up, you made yourself a cup of coffee, you made sure your kids were safely at school, you were able to get into a vehicle and drive yourself to work, you were able to put on clean clothes. And those are things you just simply can't do when you're experiencing homelessness. And so often they're faced with really difficult challenges. Do I go to a job and risk everything being lost from my camp? Or do I not take the job and know that at least my little space of the world will be protected? And that's not, I would again think that most people that's a really difficult challenge. It's a really difficult decision to be made, and sometimes there's exacerbating circumstances with weather or with other types of things that don't afford people to make, again, the choices you and I can make.
Wow. So, and this seems like a big question, but how is the county addressing these issues? And what I say, I'll put it another way. How has the county changed its approach to addressing homelessness?
Yeah, as you said, I've been doing this for a number of years, mostly locally, and certainly are some marked changes, not just the county, but the community as a whole has taken. I think they're really positive. I think back to COVID and some of the lessons that we learned in COVID, which really have affected the way that we're addressing homelessness. And there's 3 big things we learned from COVID. First, when we get out of our own way, we can work with a sense of urgency that typically government doesn't always do very well.
Sure.
In COVID, we weren't afforded the opportunity to do extensive planning and documentation. And so we just went forward. And certainly there were mistakes, but for the most part, we learned that, a sense of urgency really can drive outcomes. The second thing is I think COVID really taught us is this is an intersectional issue. Homelessness, while I'm the Department of Homelessness and Housing, it is so intrinsically touching healthcare and the criminal justice system and the educational system.
Absolutely.
And especially around healthcare, COVID taught us how to work better across those partners. Folks experiencing homelessness have a myriad of health issues that are exacerbated by their experience. They have a more difficult time accessing appropriate care. And so COVID really taught us how to work together better. And then the final thing, that is the most tangible thing we learned from COVID, this relates to sheltering in particular, is we found that when we were forced to provide shelter in a non-congregate way, because of the health issue, we couldn't have people cohabitating. People who had been traditionally assumed to be what people like to say is service resistant, said yes and came inside and availed themselves of the services that were available because we offered them something that aligned with their needs and their wants and their values. And so as we think about continuing those moving forward, some of the things the county is doing is that we're really working to diversify programs that we had. Just 10 years ago or so, our shelter system was a series of congregate shelters where people kind of lived together, whether you liked it or not. And now we're making a really, really purposeful intent to build non-congregate shelters through our safe stay communities. We're also wrapping around services with our healthcare partners in a much more intentional way. And we're focusing our sheltering programs not just on staying safe and warm and out of the weather, but ending your homelessness and recognizing that those unique paths take more time. And then as a system also trying to work much more closely with our city partners, our community-based organizations. We can't do this alone. I said at the front end, nobody has the responsibility to do this, but we all have the responsibility.
Absolutely.
And so how can we help support what the cities are doing or what our faith community is doing? And then the final thing that I think the county is really trying to do is focus more on prevention. I know that I've been quoted multiple times as a data point that's not mine, but as for every one person who exits homelessness, we estimate 2 to 3 become homeless. So we've got to work further upstream and keep people safely housed, those that are precariously housed and just on the edge, while we also work at the back end. So
Sure. Well, in that vein, let's talk a little bit about the affordable housing crisis. Yeah. Some say homelessness is a housing crisis. Others say it's a behavioral health crisis or a result of the pandemic. How do all these things play a factor?
Yes, this is my favorite topic, Kim. And I don't know if you know, but I started my career in the affordable housing development world, and it's really my passion. I'd love to end my career having solved the crisis of unsheltered homelessness and really work on what's the root cause, which is access to affordable housing. Certainly the issues you said, behavioral health, I would say criminal justice involvement, et cetera, are very closely tied to homelessness. I would never want to suggest that those are not issues that exacerbate people's experiences or the community's experiences. But nationally, there's been lots of research and some really great research that looks at communities across the country and what are the things that are most predominantly apparent in communities that have high rates of homelessness. And they looked at things that are commonly thought of. Oh, it must be the warm places where the weather's nice, right? Oh, it must be places where there's liberal politics. Oh, it must be places where there's huge drug use. And universally across the country, the one factor that was commonly found in communities with high rates of homelessness was affordable housing. And so it doesn't mean those other issues don't exist, but the primary driving issue here really is access to affordable housing. And I know that sometimes folks get concerned or frustrated when we just talk about housing. They mean that we're just going to build some housing and put some folks in there and sort of cross their fingers and hope they're doing well. And that's not at all what we want to do. We know that when you have a safe place to rest your head, again, you're going to be more willing to engage in services. And so we always overlay services into any housing opportunity that we provide. And we want people to not just solve their homelessness, but solve other challenges that they may have. And so it's really critical, but we can't do any of it without housing.
Wow. That common thread is really amazing. Okay, so let's talk personal connection here. You've been doing this a long time, Emily, and there's probably you feel some discouragement at times, but what motivates you personally in this line of work, and how do you stay inspired despite challenges you absolutely face?
Yeah, I appreciate that, and I appreciate the recognition. I think that we all have ups and downs in our life. I think that the impacts that I feel are much less than the people on the ground. I'm not the person in the camp delivering services. I'm not the shelter operator saying I don't have space, and I can't even imagine what they go through. But for me personally, I know that this topic is so important to everybody in the community. I sometimes avoid telling people, like on the weekends at a party, what I do, because it elicits so much passion, whether they agree with what I do or they disagree, and it elicits a lot of community conversations. So I always try to think, I'm working on something that's really important to the community. They may not like that I'm proposing to support people with services and shelter and housing, but they really care about this as a societal and community issue. And so I'm inspired by knowing that at the end of the day, I'm working to address something that the community is screaming for help with, right? And then, at the end of the day, my job isn't to solve homelessness for 10,000 individual people, right? That is the job of the outreach workers and the shelter operators out there in the ground. My job is to create a system that allows them to do their job better. And so I also try to just sort of think about my place in this bigger issue that we're dealing with, and compartmentalize like what I can do versus what others who are on the ground can do. And the reality is that while there are some difficult stories we encounter, when we encounter one of these great stories, it really motivates us. My team and I celebrate when we hear a story about somebody getting a job or getting their first car, or even just connect with healthcare. And so the little wins keep you motivated as well. But at the end of the day, you don't do this work unless you're really passionate about it. And so, this is how I dedicate my career, and I'm really happy to be able to do it, here at the county.
Well, Emily, our listeners, I'm sure, heard that emotion in your voice, and I see the emotion in your face when you talk about that. And I just really want to thank you again for coming in and sharing your knowledge and your perspective. That's really important. To our audience, thanks so much for joining us, and we hope you'll listen again as we feature different county department heads throughout our series, County Conversations. Thanks again for listening.